Hi, I'm Dr. Mike Evans, and I have a quiz for you. I want you to guess what the most common medical issue is for people on the cancer journey. Maybe pain, or depression, anxiety, lost appetite? Turns out the biggest complaint in people with cancer is fatigue, tiredness, exhaustion. It's important for you and the other people in your life to know that fatigue in cancer is partly normal fatigue, the fatigue you had before you had cancer, getting tired, coping with specific health problems, and so on. Then layered on top for the majority of people with cancer, but not all, is a fatigue that is different, that we don't totally understand, but it seems to come with the things that come with cancer: harsh treatments, stress, travel, the cancer itself. A fatigue that is different than normal fatigue, as it tends to last longer and is not relieved by rest and a good night's sleep. As one of my patients said, "My brain says go, my body says no." Fatigue and cancer are two words with a lot of meanings. We humans have many different types of cancer. We will all have variable outcomes, severities, treatments, so it's very difficult to generalize, and there's not a one-size-fits-all strategy here. Having said that, I think there's a massive opportunity to make progress on a pervasive symptom that you and I too often take for granted. Fatigue, like pain, is a self-perceived state. Patients often describe it as a sensation of exhaustion during or after usual activities, or even a feeling of inadequate energy to actually begin these activities. With cancer, people often refer to a new type of fatigue that is a whole body experience. This is why it's so important we pay attention to fatigue. Our energy level permeates so many different aspects of our lives. Our mood, our work performance, how we socialize, our sense of self-confidence. So to put a positive spin on this, I think taking care of your fatigue can actually treat many other important aspects of your life. A trial led by Karl Reif and his colleagues published in 2012 is a good example. 261 German patients with 29 different types of cancer were divided into two similar groups. Most of these patients had a high symptom burden: exhaustion, anxiety, pain, and so on, and many had already tried something to alleviate their fatigue. All participants received a general lecture about cancer-related fatigue, and then one group were put on a waiting list. The other half divided into groups and met once a week for 6 weeks. The investigators felt that just knowing what to do wasn't enough, so they focused on helping the patients improve their skills in positive change, what we call self-efficacy. In the sessions, there was lots of discussion between patients, and participants were encouraged to keep a diary to reflect on the experience, exercise, and make lifestyle changes. When they compared the waiting list group to the group that met and discussed their experiences, they found the latter group exercised more and felt more confident about making good things happen. This translated into significantly less fatigue, the main focus of the trial, but also less depression, anxiety, and increased quality of life. I think the message from this trial is it's one thing to hear from people like me that you need to exercise or reduce stress, but it's another to problem solve, set goals, reflect, and be supported by people who are facing similar challenges. Research shows up to 90% of people with cancer experience fatigue. It's very difficult to point to one mechanism. There are so many things going on. The treatments can be toxic, your body is repairing itself, altered nutrition and sleep cycles, stress and travel, and of course your emotional state can be a major influence on the severity of fatigue. Patients who are older, who have advanced cancer, and who have received more than one type of treatment, such as radiation and chemotherapy, are more likely to have long-term fatigue. One reason that fatigue is undertreated is there is no high-tech test. Western medicine is much better at treating things it can test for. Having said that, a good way to describe fatigue to your caregivers is to give yourself a score on a scale of 0 to 10, where 0 means you don't feel tired at all, and 10 means the worst tiredness you can imagine. If you're scoring above 4, you need to discuss this with your caregiver. If you're scoring above 7, you really need to. Another reason for undertreatment, which is interesting, is that people don't bring up their fatigue with their care team, as most believe there's nothing that can be done. So with that in mind, the question is, what is the most effective treatment? Well, it's interesting, is I would say the best treatment for most of fatigue is, well, actually, you. Yeah, sure, you may need to treat your anemia, your thyroid, or the side effects from medications, but even then I think you'll gain strength if you improve your own thoughts, attitudes, and behaviors around fatigue. Looking at the research, my take is that there are two key behaviors that we see in people who manage their fatigue well. So let's start with what I would say the research shows is the number one treatment for fatigue: exercise, activity, walking. Now, this is, of course, counterintuitive. I actually feel weird saying it, as I have this reality check image in my head of you being up all night sick or just coming out of surgery and going, really? And obviously you need to fuse the research with your own reality. But when patients ask, won't that exercise or activity make me more tired? Actually, the research says no. There's significant evidence that a low to moderate intensity exercise program can substantially reduce cancer-related fatigue and improve your quality of life. You're going to have to figure out for yourself what is the amount of exercise that energizes you and what tires you. Most trials start with half an hour a day. You can take your pick: walking, low weights, yoga, cycling, waving your arms in bed, whatever works for you. No specific form of exercise has been found to confer greater benefit than any other. Many patients find it helpful to track their activity with a pedometer or one of these new fancier electronic versions. Also, let's face it, cancer can put that 3 pounds of brain tissue that controls our levels of fear, joy, worry, sadness, and our sense of control through the ringer. And I think walking does a lot for mission control. The second key, and this may be a good life lesson for all of us, is to visualize your energy bank account. Now, many of you will find that your energy account is less with cancer. So you need to look at the things in your life that draw on that account: stressful relationships, worry, pain, sleep problems, and counterbalance these with healthy eating, meaningful work, reframing of setbacks, humor, and peace of mind. It's time to stop and push the reset button. What in my life is needlessly subtracting from my energy account, and what can I do to add to it? To keep the energy account in positive balance, we often talk about the 3 Ps: planning, prioritizing, and pacing. Planning fatigue management around treatments is critical. Almost 100% of people experience fatigue with cancer treatments. But how much you will is hard to know. For radiation and chemotherapy, this fatigue tends to get worse with successive treatments. Fatigue with surgery is so dependent on the type of operation, but most people do get better with time. Expect that it might take 2 to 3 months for fatigue levels to return to normal. For some, the road back to normal can take even longer. Your care team can help you plan for fatigue. Interestingly, research shows that general cancer coping programs aren't nearly as successful as fatigue-specific programs. A large review showed general programs were successful 14% of the time, and fatigue-specific programs 80% of the time. Typically just 3 sessions focusing on education, self-care, coping strategies, and activity management. Many cancer centers offer these programs, so sign up and don't forget to ask other patients. There's a lot of practical wisdom out there. Priority setting is critical. Having cancer can give some clarity to this. Draw a picture of your major commitments, consider where each fits on your list, then talk to the people involved to manage expectations and get a shared vision of what the new plan is. Now is the time to redesign your week around your priorities. Keep it simple: nutritious food, good sleep, good friends, and finding a place where you can visit that brings you peace. Healthy eating is both more important and can be more of a challenge with cancer. Patients often reflect on how they need to be more thoughtful about their nutrition when starting treatment. That making change in their calories, protein, or fiber intake can give them much more energy. Pacing is key, especially for people that are used to being able to go at a high rate all the time. Pacing is linked to priorities, but plan for things to take a little longer. I find pacing can also be about attitude. You're going to walk a fine line here, both with cancer and with fatigue. Being optimistic, but also realistic. Hoping for the best, but preparing for less. Being active, but not overdoing it. This will require special powers from you, I think, in being adaptive, flexible, and giving yourself time to process. All these self-care skills are much improved with a favorable attitude. Easy for me to say, but something to think about. I'll finish by repeating myself. Discuss fatigue with your care team. Discuss it with important people in your life. Don't be scared to ask for help, and maybe more importantly, take it when it is offered. Try to be active, eat healthy, plan and pace. You are the medicine for fatigue. So I hope this helps. Take care.